First of all, the first question I had in mind was, what was sort of your moment where you wanted to work in global health? How did you sort of get into this field and get involved?
Yeah. It's actually a bit of a long story. Um, Initially, when coming to my current institution, which is Emory University, and based in Atlanta, Georgia, United States, I wanted to do statistics and history because I wanted to interact with populations, but I also really wanted to design programs that were data based and data backed, something that has a track record of helping people or something that can be attributed to actual statistical progress, right? My first semester there, I realized, well, history is a little indirect for me. I want to work with people of the present day without having to chart a map towards the present day. Of course, history is very important through that. Um, and statistics was very theoretical and it was very intense. I took too many statistics classes at once. And so from then on, I actually went on a little major journey. I explored varying topics. I looked into public health, sociology, and psychology. And public health really ringed within me because, of course, a lot of public health work is data backed. There is at least the statistical analysis part of it. There is the visualization. Public health doesn't do anything just because. There's always a reason. And I really loved and fell in love with that. And the first class I took within the public health sphere at Emory was Health 250, Foundations of Global Health with Dr. John Cranmer, who's a very close advisor of mine now. Um, in that, I learned a lot about social determinants of health, implementation science, a lot of global health basics that really drew me into the global health sphere entirely. And I would say I attribute him as well as the varying topics and the designs that we learned to have really, really made me want to pursue global health professionally.
That's very cool. I guess like the statistical focus kind of lends itself to epidemiology a little bit.
Mhm.
I know
Yeah.
it's mentioned that like that was one of the focuses of yours. So, could
Mhm.
you just speak a little bit more about why you chose epidemiology and what
Yeah.
specifically like challenges do you want to solve with it?
Mhm. I hopefully plan on pursuing some kind of public health PhD, but I know for certain I want to do an Epi MPH or maybe a Emory offers a global epidemiology MPH, which is essentially merging the global health with the epidemiology aspects. But what led me to Epi specifically was that statistics background. For a long while, and I believe most of the public that do know about epidemiology knows this as well, but I thought epidemiology was just infectious disease control. I did not realize it was also non-communicable diseases or drug testing. And there's a lot of health research design that also in part counts as epidemiology because of how similar it is in how similar the research design is in preventing diseases and the models that we have within epi. So when I discovered something like cancer epidemiology or vaccine epidemiology, my mind was actually blown. I remember the moment quite well. I was with one of my mentors and his past like mentees at a restaurant, and I was talking with someone who did a 4+1 BA MPH EPI program, and she asked me, "Well, if you're interested in epidemiology, what area do you want to get into?" And I asked her, "Isn't it just infectious diseases?" And she said, "No, there's plenty, plenty, plenty of areas that you can really delve into." And from then on, I really fell into the epi rabbit hole. And now, hopefully, the area that I'm charting out for myself, at least the area that I'm currently reading the literature on, hopefully being a competitive PhD applicant for, is really that intersection of global health, epidemiology, community health, designing programs that are sustainable, that are community based, that have a statistical background via EPI to succeed in preventing chronic diseases in the long term globally. And so that taken a long time from that. I've actually made a LinkedIn post about that as well. one thing I do is I keep the knowledge that I've learned in all my classes. I keep specifically what passions I've gained from each of my courses, and I kind of add on to it. So it's kind of always a work in progress with that. But to answer the question, I really, really love epi for its variety. I love how connected epi is to health research, and that really was what attracted me to it.
That's cool. Yeah. I love that you have like very clear connections and like intentionality with everything that you're doing with regards
Mhm.
to global health. Um, so then let's talk a little bit more about your journey with CGHI. I know you're super involved right now with the chapter and stuff. Initially, if you still remember, how did you first hear about CGHI and why did you decide to join back then?
Yeah. I was a freshman. It was, I believe, the middle of spring, or maybe it was winter break. But I saw that CGHI posted an intern role on LinkedIn. And at the time I was taking Foundations of Global Health, and it was something I was really interested in. So I just clicked apply and I got in, and I was very, very excited to really just be thrusted into the program and to watch it grow quite rapidly as of late. And I would love to say there's this like massive background story where I looked up CGHI and everything, but really it was Charlie and Jelena really taking a chance on me, seeing at my resume and seeing that there were areas for improvement that I could gain from CGHI that led me to be hired as a intern.
Yeah, I think that makes a lot of sense. And personally, for me, I joined pretty recently, and I think my story kind of aligns with yours in that it's like a great community, and
Mhm.
I'm really glad of all the support that it's given me. So then, what made you want to like take the next step and start a chapter at Emory? Was this like under the guidance of the other members, or is this like your own
Mhm.
initiative?
Yeah. When I was an intern, I was having a lot of trouble finding what I wanted to do. Primarily because the main platform for the interns is online. Of course, we're a global organization. I'm personally someone that really loves getting hands-on and interacting with people in person. And so I was kind of hovering this or that. I have a lot of community engagement experience, which delves into community health promotion. But I took advantage of that to become a partnerships intern, and I designed like varying partnerships that CGHI could take if they wanted to, like ways that we could reach out to American domestic or international organizations to potentially collab. It's kind of similar with the alliances system we have with Multipod. Um, but for the most part, I believe around May or so, Jelena, it was either Jelena or Charlie, but one of them proposed that I start a branch at Emory. And it would essentially take in the experience I have with community engagement, as well as the desire to work on global health topics in person. And as far as like the topics go, like what our branch would specialize in, I already knew from the start what that might have been. An area I was very struggling to break into was the research realm. And so, and I knew a lot of my peers. Emory is very much a pre-medicine, pre-nursing. It is a very health sciences focused school. And I knew a lot of my peers were also really struggling to get something out there, get something published. And so I talked with a few of my friends, and they said they would be very interested in joining a international NGO branch, where they would actually be able to derive specific time towards publishing, like similar to a newspaper, publishing an article about their global health topic of choice. Since a lot of people don't know about global health as an undergraduate, it would also be a really good chance for advocacy. And so what happened then was I established what was CGHI's Emory at the time. And I made a intern advisory board where we actually had both Charlie and Jelena, as well as I believe 10 other interns or related CGHI members, come together over the summer to really, really plan it out, to make sure that we knew our first step, our second step, our third step. We had everything intentionally designed and ready so that when we recruit members, we can just get started and go. So that actually took all summer. That was a multi-month experience, really delving into the program, the nitty-gritty parts of it, how our publishing system should work to make sure that we produce high quality materials. Um, and yeah, eventually led to August, where I hired my executive board, and we have over 50 members right now, which is actually quite insane given how we became chartered and recognized as an organization by Emory University in December. So it has really been an amazing experience. And one where I've learned quite a lot about designing and starting up a new program or organization
Wow,
branch.
congratulations. You've gone very far, clearly. I guess and jumping around a little bit with relating to the Emory chapter, what is your future vision for the chapter in like 2 to 3 years? What would you hope that this branch is known for?
Yeah, 2 to 3 years. I hope that we actually make a difference within our current members' experiences and the opportunities they're able to accomplish. My vision is that we grow to 100 members and our general body meetings are very active and involved, and that once you are ingrained enough in a specific site or at a school, people around the organization will talk about it and it will grow through word of mouth. That is something, that's the vision I hope to see within CGHI ATL. But also within the publishing sphere, I really hope our outputs can be finished and done. I know one of our groups are have finished their um, articles and it's being reviewed by our editors to be sent to CGHI in maybe a few weeks. But really like hearing back from students who have said it is very exciting seeing my article on CGHI's website and something that I can add to my resume as newspaper publishing or just general publishing experience. Um, and maybe even hearing back from some students who said, I the PI of this study was really impressed with my article that was published by CGHI. I want to thank you for, or thank this team for the time that I've spent on here. So really like the positive benefits of joining CGHI. Of course, that stuff is not immediate. It takes time to get there. And so really getting feedback, getting positive feedback back would be a huge motivator as well as a bit of a vision I have for the organization moving forward.
Yeah, that's great. It seems like the organization's already well on its way. So then for someone in your position, looking back, what would be a piece of advice or any, I guess, mentors along the way or help that genuinely changed your direction?
Mhm. I would say be intentional. Right now, I'm very, very intentional about practically everything that I do professionally, whether it's academically or the PhDs or the internships, et cetera. I'm very, very intentional with the steps I want to do. And being intentional has brought quite a lot of benefits, but being intentional yet flexible has brought quite a lot of benefits in, say, my resume, the opportunities I was able to get into, like the internship with UPenn. Um, as well as just general recruitment and footing for the ATL chapter. And so it's good advice for anyone, but I feel like if I had embraced it sooner, maybe some new experience that would have changed everything or that would have changed my footing or vision of public health as I'm taking it now would have happened in the past. There could always be positive changes. And so I would say telling even my incoming freshman self, like be intentional. It is okay to be intentional. It's okay to overthink, just don't overthink too much. And that kind of advice would have really helped me back then.
Yeah, I can definitely hear the intentionality with the way you talk about everything that you've done so far, and it sounds very impressive. Um, so I guess talking about that freshman thing, if there was like a freshman student or even a high school student walking up to you and asking you how they would be able to get on the same path that you are with global health, epidemiology, and working nonprofit, what would be your first piece of advice to them?
I would say create a vision of activities. This is what I did. Um, I created a vision of activities that I wanted to accomplish or I wanted to be involved in. One of which was at the time I just put down internship. I didn't really know, I didn't go too far deep into the details as far as what I did want to specifically do or the organization I wanted to do. But at the time, I had envisioned myself to be in an internship by my freshman year, later freshman year-ish. I had envisioned to start an organization or a club on campus. The fact that they both kind of came together was really beneficial in my circumstance. But for high schoolers or incoming of college freshmen, I would really advise you to lay out what it is you really want from the college experience, make a plan for it, and then attempt to execute. There will be changes that will go on and will occur. You might want to go back to the document and say, remove an internship for your sophomore year because these classes are way too stressful. Or maybe push research forward from junior year to freshman year because you got into a research team and you're super excited and thrilled to be there. Um, if you're having trouble figuring out what it is that you want to do or what it is that's expected, look into that. Look into LinkedIn is an amazing resource. I'm active on there 24/7. It's a borderline addiction now, but use LinkedIn's or ask current students about, well, what would be beneficial for me to have before I graduate? And then use those experiences that you've earned or gained from other people as a guide to lay down, well, before I graduate, it would be beneficial to have an internship, to have research experience, and to have a club on campus, and create a realistic timeline for that.
Thank you. That is great advice for everyone and for myself as well because I'm graduating high school in a few months and entering college. So yeah, thank
Congratulations.
you for that. Thanks. Those are all the questions I had. Did you have anything else you wanted to add on or tell, I guess, like the broader CGHI community from this interview?
Yeah, ATL branch has been growing, and I'm very, very excited about the progress that we make now, as well as the next fall and moving on to next winter. Um, just as like a general response to current feedback, we will be hiring or we will be adding to our exec board a essentially someone who specializes in global health social media. So we would essentially be our output on our social medias will start increasing very, very soon. I'm very, very excited for that. If there's a topic that you're particularly interested in us delving into, our main Instagram is at CGHI So I would love it if you would follow and even offer tips or advice for our incoming social media manager.
Okay, perfect. Thank you.